Unsurprisingly, the head of Aetna, Mark Bertolini, is not a fan of single-payer healthcare. Gee, I wonder why. And now he has gone on the attack. Now, Bertolini, speaking at the Strategic Investor Initiative Conference in New York on Tuesday, in response to a question from The Intercept, said that the Sanders single-payer bill does, quote, nothing to fix the underlying cost structure of the healthcare system. Now, he said, if we refinance a lousy product, what do we get? A lousy result. So if we refinance a lousy product, what do we get? A lousy result. So, okay. So let me go to those statements right there. For one, it's Mark Bertolini that does not understand, or maybe he does understand. The big problem with the cost structure of our current insurance system is the fact that it's for profit. You're the problem. See, insurance companies and their massive amounts of overhead, advertising costs, and shareholder profits are actually costing Americans a ton in health insurance. And by the way, did he just call healthcare insurance a lousy product? Just saying. Now, Bertolini goes a little bit further, and this is according to an article by Li Fang of The Intercept. He says, the Aetna CEO also ridiculed proponents of single-payer, suggesting that they are confused. Some supporters, Bertolini warned, are in fact talking about socializing all the hospitals and doctors. Everybody's going to work for the government. No. That's not true. You're either confused or you're lying your ass off. I can't tell which. Single-payer does not mean the hospitals will be run by the government. That's incorrect. Just like now, a lot of the doctors and hospitals will be privately run. They'll just get paid by the government. The difference here is that you will be insured by the government. Your premiums, you won't have to pay any premiums. Your health care would actually come out of your taxes instead of out-of-pocket costs and premiums, or through your employer. It's simply one payer as opposed to multiple payers, some with profit motives. So again, I think he lied about that. And then he asked this room of investors and analysts to name a country that does single payer. Now, let me name a few countries. First, Canada. That's the obvious choice, right? In fact, that's what his analysts had answered. You also have Norway, Finland, Japan, the UK, Italy, Spain, and Iceland that have a strict single-payer system. Now, there are other countries out there that have a two-tiered system, which is single-payer plus a private insurance option to supplement plans, or some of them also have an insurance mandate, kind of like the ACA. Now, interestingly enough, places within the insurance mandate actually make sure that their systems are nonprofit. Now, the Swiss system is an insurance mandate, right? So what happens in Switzerland? Well, for one, everybody carries two different government mandated policies. One is personal everyday medical health insurance. Now, if you're poor in Switzerland, the government will subsidize you. And the second insurance that you need is accident medical insurance, which is, of course, half paid by the employer and half paid for by the employee, or if the employee can't afford it, subsidized by the state. Now, Switzerland, again, Switzerland makes sure that their insurance companies are not for profit. Now, that is a big difference from what they do in America. And as a result, in a lot of these countries, there's a 98 to 100% coverage rate. They're truly universal systems. In America, we don't have universal health care because there are still millions of people who can't afford coverage. Now, Bertolini seems fine with that as long as he and his company keep making money. Now, again, he asked that question, and several participants did answer Canada. Now, he didn't like that answer, and he said, well, Canada, he sees the problem with Canada is that they have a government-run healthcare system. They're not single-payer. They're single everything. But as I just explained, that is actually incorrect. There is things that the Canadian government does not cover in their healthcare system. And so they do have also supplementary insurance. So, which I realized that I forgot to put them in the second tier system. There is actually supplemental insurance. There's dental insurance that they offer in Canada as well. So I do apologize for that little mistake. But anyway, let's go forward with that. Now, I think Bertolini, in my opinion, intentionally confused SinglePayer with the single provider system. Now, a single provider is sort of like the National Health Service in the UK. Now, under that service, the doctors and providers do work directly for the government. They're government employees. This is not what Sanders is pushing. That's actually not what SinglePayer is. Under Sanders' bill, all Americans will be enrolled into Medicare, and patients would be free to choose their private sector healthcare providers. So no longer will you not be able to choose a doctor that's not in your network, right? If you like your doctor, you can keep your doctor because all doctors will be in one network. So now the legislation also provides a range of cost-cutting measures, including provisions to lower drug prices. There's a lot of stuff in there. It's 75 pages long. So now finally, Bertolini goes to the last most ridiculous argument, and he says there's nowhere in the Constitution that says we will need to provide people health care. Oh, it's not in there. Well, if it's not in the Constitution, we can't do it. Well, wait a minute. There's a lot of things that we do that isn't in the Constitution. Does that mean we should stop doing those things? No, that would be dumb. And that would actually cost a lot of money to do, to undo everything that isn't in the Constitution. But anyway, he also continued that I think government-run healthcare would be a bad idea because I think you end up with a central planning problem that has crushed the Soviet and Russian economies, so there's some obvious red baiting there. Well, the good news is that if you don't like government-run healthcare, well, it's a very good thing that Sanders' bill is not that. But look, seriously, I do think he knows the difference. I do think he's bullshitting people. And you want to know why? Well, it's because the money. Follow the money, right? During his talk, Bertolini boasted that Aetna's stock price surged from $29.85 per share in November to $162 a share this week. And in 2016, he received compensation package worth $41 million. So he's getting rich off of this. But look, that's not to say he's a bad CEO or technically even a bad person. He just has bad ideas, right? Fong notes that the majority of Bertolini's talk was centered on his work to stimulate a better workplace practice at his company, from raising wages of the lowest paid Aetna employees to providing in-house yoga programs. But look, all that stuff is well, fine, and good, but I think everybody deserves health care. It's a human right. And our for-profit insurance model, even if they give, the companies themselves give nice little perks and benefits and yoga classes, I still think profiting off somebody's health care is immoral. Okay? Especially given the fact that people die if they can't afford health insurance or health care. And thanks to that profit motive, these companies will not be in a position to support SinglePayer to make sure that people don't die if they can't get health insurance. Because under SinglePayer, everybody does get health insurance. And that's why companies like Aetna funnel millions of dollars to Republicans. In fact, in 2012, Aetna inadvertently revealed that it funneled more than $7 million to GOP dark money campaign groups that specialize in electing Republicans without disclosure of their donors. And these Republicans are very, very happy to work for their donors to make sure that we don't have SinglePayer or universal health care that is affordable for everyone. Like I said, you just got to follow the money, and then you know exactly what these people stand for. Hey everybody, thanks for watching this video. If you want to see more like this, please hit the subscribe button below. And if you want to support truly independent progressive media, please consider becoming a patron at patreon.com/TYTNation.